UNITE is actually a retrospective multi-institutional study of patients with advanced urothelial carcinoma treated with targeted agents such as enfortumab vedotin and sacituzumab govitecan. It was mainly designed to look at real-world outcomes. So as you know, we have these clinical trials that are done, but a lot of people or many patients are excluded based on different criteria. So patients who have predominant variant histology, poor performance status, very aggressive disease, and we just wanted to look at the real world outcomes using this study. And we have 16 US sites, and we have data from all these sites that we use to look at outcomes. And in the past, we've looked at outcomes with EV and not just biomarkers. And this analysis and some prior analysis that we have done have focused on looking at biomarkers associated with treatment outcomes. But we have future analysis that we're doing that are not focused on biomarkers associated with outcomes. So it's really a study where we could do different analyses to look at different things and take on different angles to basically fill any knowledge gaps that we have. So as you know, before 2016, chemotherapy was the only treatment available for advanced urothelial carcinoma. But since then, we've had immunotherapy, EV, SG, targeted therapy such as erdafitinib becoming available for this patient population. And now comes the question of which treatment to give the patient and which treatment should we give first. And I think it's very important as the therapeutic landscape is expanding that we have tools to help us select treatments for these patients. These patients, once they are diagnosed with advanced or metastatic urothelial carcinoma, the prognosis, it doesn't look too good. And we just want to make sure that we give the best therapy possible at the earliest time for that patient. So we want to prioritize the therapy that is most likely to benefit the patient, and looking at biomarkers is one way to do that. In our analysis, we found that patients who had alterations in TP53 or MDM2, they had improved outcomes when they were treated with SG. We actually adjusted for clinical characteristics. So we conducted a univariable analysis and a multivariable analysis. So first, we looked at clinical characteristics in all molecular biomarkers that we were assessing to see if there were any associations with outcomes. And we shortlisted, and we found some of the clinical characteristics such as neutrophil to lymphocyte ratio, hemoglobin, that were associated with outcomes. And we wanted to basically adjust for these and really flesh out if there are any molecular biomarkers that are associated with outcomes. And so we included anything that was significant on the univariable analysis, plus also some clinically relevant variables such as, histology, age, ECOG, status. And we wanted to see if, when we adjust for these, is there a molecular biomarker that we can find? And that's when we found the TP53 and MDM2 to be associated with improved outcomes. This association was statistically significant. The p-value was, I think, 0.02. These hypotheses, they are hypothesis generating, these findings are hypothesis generating, but the real thing is that this is a retrospective study, and we do need to validate this before we can alter the way we treat patients and the way we choose patients. Not to say that this can't guide clinical decision making, but I think we need to do much more work before we're able to take this into the clinic and use this as a practice. We did a similar thing with EV where we adjusted for clinical variables, and we actually found a few molecular biomarkers to be associated with outcomes to treatment with EV. So we found that patients with alterations in ERBB2 and also KDM6A have improved outcomes, and patients with PDL high expression and TMB low have inferior outcomes when treated with EV. And we just have a larger sample size for this analysis. So we looked at 303 patients versus 90 patients for our SG analysis. So that's actually an analysis where we did look at, but that data hasn't been presented yet, and we're hoping to present that in a future meeting, but not in this analysis.